So the syndrome I decided to pick is intracranial hypertension syndrome. It's a syndrome characterized by high cerebral spinal fluid in the skull. It can cause a lot of issues like damage to the brain and spinal cord, also loss of vision, and even blindness. Some clinical manifestation of this syndrome of course, a headache, loss of energy, weakness when moving or talking, vision loss, or vomiting. The first neurological syndrome I'm going to compare ICP to is meningeal syndrome. And this is a condition where the meninges become irritated, and like ICP, the patient may experience a headache. However, they're also going to experience a fever and stiff neck. Meningeal syndrome can be caused by a variety of factors, one being infection, 2, substances from cancer cells can get into the bloodstream, and it can be caused by virus or fungus. So meningeal syndrome has to do with irritation of the meninges, while ICP deals with the overconcentration of cerebral spinal fluid, so they're totally different. Another neurological disorder I decided to compare ICP to is Parkinson's. And Parkinson's is due to an imbalance between chemicals acetylcholine and dopamine, while of course ICP is caused by head trauma, aneurysms, infections, brain tumors, etc. Another important thing to note about the differences between Parkinson's and ICP is that Parkinson's creates involuntary movement that you can't control, while ICP just can cause weakness in movement. And as well, ICP causes visual loss, while Parkinson's does not. Okay, so the last syndrome I'm going to talk about is called central sensitization syndrome. This is due to damage to the central nervous system. So what happens is the patient may experience frequent burning sensation, or also they experience extreme reactions to changing temperatures or touch. This syndrome can develop years or months after the damage occurs. And the only thing it really has in common with ICP is that they can both be caused by damage to the brain. Another difference between the two syndromes is that central sensitization syndrome is pretty hard to treat because it's a syndrome that's pretty resistant to pain medication, while ICP can be treated pretty easily. A lot of times, a small hole is made in the skull with a shunt to drain the cerebral spinal fluid. Medications can also be used to treat ICP to lower the pressure in the skull. A lot of times, mannitol is used, which can lower the pressure. So now on to the diseases within the syndrome. One important thing to note about ICP is it can lead to a syndrome I discussed earlier, meningeal syndrome, because the increased pressure can often irritate the meninges. As I discussed before, vision loss is a big issue with ICP, but even worse, blindness can occur if it is left untreated for long enough. Another consequence that can occur from ICP is something called pulsatile intracranial tinnitus. This is caused by the narrowing of a large vein in the brain, and it's the perception of sound when there's no external sound. Also, something called diplopia can occur when you think you're seeing two objects, but it's really just one, and this is due to the 6th cranial nerve dysfunction.